pacemaker placed. Generally, people have a pacemaker placed for low heart rate, and sometimes complete heart block, where the upper chambers are no longer going to transmit the impulse down to the lower chambers. There's a problem with the wire, if you will, from the upper to the lower chambers. Having a pacemaker is I would say, a minor surgery. Usually takes an hour. Sometimes it's a lot quicker. Sometimes it may be slower. I think if your family member's in the waiting room, you may think it takes 2 hours or longer, because there's a lot of paperwork beforehand and paperwork afterwards. You won't have anything to eat after midnight. You might have to hold certain blood thinner medications. Usually we have people, if they're on aspirin and Plavix, those antiplatelet agents, almost always they can continue on those. The anesthesiologist will make you sleepy. It's a lighter sleep. It's not general complete anesthesia on a ventilator generally. If you feel uncomfortable, if you grunt or groan, we give you more and you go back to sleep. It's called conscious sedation, and it'll be moderate, or it could be deeper than that. We'll clean everything up, usually on the left side of the chest. That's your traditional place to go. Give you some numbing medicine as well here, make an incision, make a little pocket for the device, put leads down into the heart through the vein, one in the upper chamber, one in the lower chamber. Sometimes you might just get a single chamber device. It depends on the circumstances. We'll connect that up to the pacemaker, put it all under the skin, sew you up, and then we're done. For a new device, almost everybody would spend the night. Nobody would generally go home the same day. Probably a 99% chance you will go home the next day unless we see some issue. You will get pain medicine overnight. You'll get antibiotics before and after the surgery. The device will be checked the next day, make sure that the leads are in place, that the heart hasn't rejected any of the leads. There is follow-up as far as checking the surgical wound and also checking the device, and it has to be optimized for your particular problem, the reason that it was put in. The risk of pacemaker placement, I tell people with any surgery or procedure, risk of stroke, heart attack, and death. Just like if you have your gallbladder out, your appendix out, or a colonoscopy, there's always that risk of those things. The main risk particular to this are risk of a collapsed lung. We work with needles above the lung, so there's a 1% chance of perforation of the lung that's treated with a chest tube. Risk of perforation of the heart, I'll say the risk is 1%, it may be less than that. We put leads and catheters down into the heart, or pacemaker leads down into the heart, and so there's a risk that you perforate through. If that happens, that's generally treated with a chest tube, a tube that goes under the breastbone, drains blood away from the heart. It can require open heart surgery to fix a hole in the heart. There is a risk of infection. That risk is about 1%, maybe higher, that the device will become infected and then has to be replaced, has to be taken out and replaced when the infection is over. You can even have a type of infection much later in life, like severe infections that involve the bloodstream. They're once-in-a-lifetime infections. Again, they can seed that device, just like if you had an artificial hip or artificial heart valve, and again, have to be taken, the device has to be taken out to clear the infection and replaced when the infection's over. Risk of lead dislodgement that we talked about 1% chance of that. If that happens, you have to go back in and fix the lead, put it back into the heart. There is some restriction on lifting your arm. Usually it's between 4 to 6 weeks. You cannot lift your arm any higher than this, no higher than 90 degrees. If you lift your arm up, you're going to pull the leads out of the heart, and you have to go back in with repeat surgery to fix that.